everyone, I am Doctor Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel to women's health, where we aim to educate, empower and inspire women on all things to do with their bodies. If you have any questions that you'd like answering, please drop them in the comments below and our team will get researching so we can produce an evidence-based video for you. If you would like to learn more about women's health, feel free to download the free ebook, which is in the description down below. Or if you're on the move and you want to learn a little bit more, you can check out our podcast, Fertility and Femtech. You can follow me on Instagram and TikTok, and also subscribe to us on YouTube and share this with all the people that you love. Today, we will be discussing top tips on helping you to get pregnant. So let's dive straight in. Tip number 1, understand your body, your menstrual cycle and your periods. We've done previous videos on your hormone health, on how your menstrual cycles work and how hormones change with them in previous videos, which I'll link over here. Knowing about your body and how your hormones work can help you to get pregnant, because you'll know when you're most fertile and how your hormones can work for you so that you can optimize your chances of conceiving. So ovulation occurs 12 to 14 days before your next cycle. So if you have a 35-day cycle, then ovulation for you will occur 14 days before that, which will be on day 21. If you have a 28-day cycle, then your ovulation will occur on day 14, which is 14 days before that. Once you've worked out your ovulation date, you can then work out your fertile window by minusing 5 days from that date. So if it's day 21, then you want to minus 5 days, which takes you to around day 16. And between day 16 and day 21, that would be your fertile window. So that is the time when you're likely to ovulate, and you want to make sure that there is sperm ready in the fallopian tubes so that it can fertilize with your released egg. It is of course important to have sexual intercourse throughout your cycle and not just limiting it to the fertile window, because we know that month to month women's cycles may deviate slightly. So if you're going through a stressful situation, if you're going through any medical treatment, if you are eating less, eating more, exercising less, there's so many variables that can change the length of your follicular phase of your cycle every single month. And that's why it's important to have unprotected sexual intercourse every 2 to 3 days throughout your cycle to make sure that we're optimizing your chances of getting pregnant. Now, you can predict when your ovulation may occur via using various different ovulation techniques. So you can use ovulation tracking just by using an app on your phone, or you can use LH ovulation kits or strips, which are urination strips, and that helps you to identify if there's luteinizing hormone present in your urine due to a recent surge. When you have your LH surge, that means that ovulation will occur within the next 12 to 24 hours. And that means you are very likely to release an egg, and that is when you want to be having sexual intercourse, or actually 5 days before that, ideally. The second tip is making lifestyle changes and taking supplements. So lifestyle changes are so important to ensure not only you are in your optimum state to receive a pregnancy and to maintain a pregnancy for 9 months, but also for the health of your baby, not only when in utero, but also throughout its life. The way your body is can then predispose your baby to conditions later on. So there's so much evidence on the risks of maternal obesity and how that translates to childhood obesity. So we know that keeping your body in ideal state is what we need during pregnancy. The second tip to help you to get pregnant is lifestyle factors. We want to optimize your lifestyle so that you are in peak state. First of all, we'd like you to have a good BMI between 18.5 to 24.9. There is lots of research on the risks that a overweight or obese mother has during pregnancy, and how that risk of being overweight can then be transferred to baby. So you're more likely to have an overweight baby, and their risks of having childhood obesity later on in life are much higher if the mother is overweight. So how you treat your body now can actually influence not only your life, but also your offspring. So the ways you can do this is by having a healthy Mediterranean diet, so having a little bit of protein, meat, fish with lots of vegetables, and having good fats in your diet like olive oil, having avocados, having lots of vegetables. and reducing your saturated fats. So these are fats that increase your bad cholesterol in your body. And you can get these from having lots of butter, cakes, biscuits, all those sweet, delicious things that everyone likes, which are just not good for you. As you probably know, you should not be doing drugs, smoking, or having alcohol during pregnancy or even when you're trying to conceive, because it can interfere with your ovulation and reduce your chances of conceiving. Caffeine, everyone loves coffee. You should reduce it to around 200 milligrams per day when you are pregnant. So this is around 1 to 2 cups of coffee. Exercise, we advise exercising around 3 times a week, moderate intensity exercise, to make sure that we're protecting your cardiovascular health. Third tip to get pregnant is to take a pregnancy vitamin. You can get these from the supermarket, the pharmacy, over the counter. You don't need to necessarily get these prescribed from your doctor unless you need a higher dose vitamin. The key vitamin that you need to take is folic acid, and you need to take 400 micrograms of this 3 months before you try to conceive, as well as into the pregnancy up to 12 weeks. The reason why you need to take it for this duration of time is because it helps to prevent pregnancy issues to your baby, specifically neurological conditions like spina bifida, which is a neurological condition that affects its spinal cord. So by doing it up to the first trimester, we know that that's the time when the organs are developing and the baby's at highest risk of this. There's factors in your history that put you at higher risk. So if you're overweight, if you're taking enzyme-inducing drugs, if you've got a family history of neural tube defects, then you may need to be on a higher dose of folic acid, which will be 5 milligrams, and this would be something that your doctor would recommend and would prescribe for you. The next important vitamin to take is vitamin D. If you're living in a country that isn't very sunny, like the UK is not very sunny, although it is quite sunny today, luckily, then you may need to take a vitamin D supplement. This also goes for people that wear quite long sleeved clothes. If you don't expose your skin very much, then you won't get very much absorption of the vitamin D through your skin. So it would be advised for you to take a vitamin D supplement, whether you're trying to conceive or not, because vitamin D deficiency can lead to loads of symptoms like tiredness. It can cause you to have joint pain. And so by taking a vitamin D supplement, it helps to not only protect you and your symptoms, but also the baby's development. So make sure if you are taking a vitamin, it contains vitamin D. My fourth tip for pregnancy is knowledge. And that is the knowledge that there is a link between age and pregnancy. As women and men get older, the risks to pregnancy get bigger. However, this risk is greater in women. The quality and quantity of ovarian reserve, so your egg count, gets less with time. The older you are, the closer you are to the end of your fertile years. So this not only reduces your chance of conceiving, but it causes strain and can cause problems to your pregnancy. If you are less than 35 and you've been trying for a baby for about a year, we suggest you talk to your doctor. If you're more than 35 years and you've been trying to conceive for about 6 months, you should definitely be talking to your doctor. And if you're over 40 and want to conceive, then you should definitely be talking to your doctor as soon as possible. And the reason for this is because at around 40, you could be going into a state of perimenopause. And we know that menopause symptoms can start up to 10 years before you actually stop your periods. So we know your ovarian reserve is dropping with time. And we need your eggs to be in the perfect state in order to produce a healthy pregnancy. If you're known to have a past medical history or gynecological history where you may have had surgeries to your ovaries, blocked tubes, if you've got irregular cycles, or if your partner has sperm issues, then you would need to talk to your doctor sooner, because you may need some medical intervention to help you to get pregnant. But we know fertility treatments are most effective in younger people. So in order to optimize your chances of success, please do talk to us sooner if you have anything underlying. Now, the final tip to help you get pregnant is to do with sex positions. So there have been so many comments on my TikTok, and I've had a few messages on Instagram surrounding this topic of how sex positions can change or increase your chances of conceiving. So I've done a whole video actually on sex positions because it seems to be so topical. But what actually happens during sexual intercourse is that sperm is deposited in the vaginal canal. It then swims up into the cervix, into the womb, and goes to your tubes. So no matter what sex position you'll be in, the sperm will always be deposited in the vaginal canal as long as ejaculation occurs there. So there isn't any clear evidence to suggest that one sex position is more likely to get you pregnant than another one. If you do want to learn more about this topic, as I said, do check out the video on that one. So to summarize today's video, we have gone through 5 top tips to help you to get pregnant. I hope these tips help you. If there's anything that you've actually tried and has helped you, please drop them in the comments below so that we can help to educate other women in our community who are trying to conceive. As always, you can ask me any questions on Instagram or TikTok, and I always endeavour to get back to you. All the best, take care, bye.